Research has it that PCOS affects millions of women all over the world. Regardless of this prevalence, many women are living with PCOS without being diagnosed. So today, let's break it down. What exactly is this PCOS? What causes PCOS? Can it be treated? Can it be cured? So what are the ways you can manage PCOS? Now, PCOS means polycystic ovary syndrome. Like the name implies, poly, many, cyst, there are many cysts. Where does it happen? In the ovary. And it has peculiar symptoms or peculiar signs. And this is why it is called syndrome. All right. So polycystic ovary syndrome. Normally every month, the ovary releases eggs. All right. And this is by the help of the female reproductive hormones like the follicle stimulating hormone and the luteinizing hormone majorly. So these two hormones and other hormones like the estrogen and the progesterone, they all play some roles in this production. Now, these are female reproductive hormones, right? The estrogen, the progesterone, the luteinizing hormone, and the follicle stimulating hormone. So, like I said earlier, every month the ovary releases and produces eggs. Now, when a woman is experiencing polycystic ovary syndrome, what happens to their body is this. There is a shift in the proportion of the female reproductive hormones that are being produced, making the male hormones, that's the androgens, to be higher than the female hormones. Instead of the ovary to produce the eggs, instead of the ovary to release those eggs, it is producing cysts. Cysts are forming because of the impact of the male reproductive hormones known as the androgens. I'm going to take it again, so calm down here. PCOS is known as polycystic ovary syndrome. That is polycystic, many cysts happening in the ovary with peculiar signs and symptoms. That's what makes it to be a syndrome. All right. So polycystic ovary syndrome is a hormonal dysfunction, is a hormonal problem that happens in the ovaries. Normally, the ovaries every month releases eggs by the help of hormones, by the help of the female reproductive hormones, the luteinizing hormone, the follicle stimulating hormone, the estrogen and the progesterone, and other female reproductive hormones that comes into play. Now, when a woman is experiencing PCOS, what happens is this. Instead of their body regulating in a normal or optimizing these hormones so that the eggs will be released, their body instead is producing more of the male reproductive hormones known as the androgens. So instead of the eggs to be released, the ovary are now producing cysts. No thanks to the male reproductive hormones, yes. So the male reproductive hormones are making the ovaries to produce cysts. These cysts are kind of little sacs that are fluid filled, like there are small fluid filled in these sacs, and this is what is called cyst. So they kind of take the space, they kind of sit where the eggs are supposed to sit. They kind of play the roles of the eggs, but you know these are not the eggs. So this causes a shift in the overall makeup of the ovary, and you begin to experience the symptoms of PCOS. So that is exactly what happens to any woman who is experiencing PCOS. Now, what can this cyst? What, remember, they are cysts now. So the eggs are not being released as when due. The cysts are already taking positions where the eggs are supposed to be. So you will notice that there won't be ovulation. There will be anovulation, and because there's anovulation, most women will not experience missed periods or irregular periods. There will be irregularity of their periods because one, the hormones are not balanced. The hormones that control the periods are not balanced. So there is irregularity, there is missed periods for those women. And because the estrogen is also impacted, the estrogen has a way of regulating weight in women, all right? So because the estrogen is not balanced, there is this roller coaster going up in the hormones that regulates the body weight and size of a woman. The woman may become overweight, obese, especially around the abdomen. You may see yourself getting this big around the abdomen, even when you're eating so little. But because there is an imbalance happening with the hormones, even the later you are eating, the body is storing and stocking them in your body fats. Remember, it is the androgens that are causing this, all right? And you know, androgens are known to increase hair growth. So a woman with PCOS may also experience excessive hair growth. You notice hairs all over your, like where you don't normally have hairs, you're beginning to have hairs there. Your face becoming to grow, your face is growing more hairs, your body is growing more hairs as usual, and there may be acne breakout. All right, remember these things are because it is hormonal. the hormones are no longer under balance as it's supposed to be. So there is acne breakout, you see pimples. This month you go to the spa, you get treated of your acne, next month is returning back again. So when these things are happening, well, for your hormonal profile test, so you know if your hormones are okay before you keep going to the spa, visiting the spa every month for treatment of acne. So when there's acne breakout like this and you are a woman, please and please and please ensure that your hormones are balanced. Yeah. And the most difficult symptom that these women experience, especially to women who are trying to conceive, who are looking for babies, is inability to get pregnant. Remember, ovulation no longer happens the way it should happen. The cysts are taking over, the eggs are not being released. And when the eggs are not being released, even if the sperm enters into the body, there is no egg to fertilize. You see where the problem lies now? There is no egg to fertilize, all right? So because there is no egg to fertilize, there is problem with fertility. There is problem with fertilization. There is problem with the woman conceiving. And beyond all these physiological signs and symptoms, it affects the mental health. Yes, because the woman becomes overwhelmed. Who wouldn't be actually? The woman becomes overwhelmed and you wonder, you are exercising, you are doing this, you are dieting, you are, but yet your body keeps adding up. You keep getting acne breakouts. You go to the spa, you are, yeah, encouraged, it's not going to happen again, blah 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 and all that. But at the end of the month, you are seeing your face and going back to previous setting, to default setting. So it's kind of impacts on the mental health. And most people having this PCOS tend to look at themselves as they are not women enough, especially those who are finding it difficult to conceive. And if you're a man watching this video this time, please encourage your wife to go for hormonal profile test so that you will know what the problem is when infertility sets in, because PCOS can actually make couples question their fertility. Yes. So you have to understand that sometimes it is not your woman's making. These things just happen. And like I said earlier, it is a hormonal factor. So the hormones will have to be treated first before any other thing. Now, there is this important factor that many people fail to also look at. Now, there is a familial factor for PCOS. Yes, there are genetical tendencies. Like if your mother, your sister, or if you have a close relative who has experienced PCOS, there's also a probability that that increase in androgens, that trait that carries that increase in androgens may also be transferred from this generation to this generation. All right. So it doesn't seclude, it doesn't just say it has happened, it won't happen with any other person. No, it can happen even with another person. All right. So PCOS can be genetically inclined. So when you are checking yours, look out for your daughter, look out for your relative, look out for your sister. Ask your sisters question. If you have sisters, get a close relationship with them. Speak about these things. It's nothing to hide. All right, it's nothing to hide. Don't just hide it on yourself. You may not know, your sister may even be battling with the same thing and may be ignorant of the things you know. So if you're watching this video and you have these experiences, do well to share with somebody, do well to talk it out, do well to speak with your close relatives to know, to ensure that these things don't just get undiagnosed. So get in touch with your sisters, get in touch with your mother, ask your mother questions, ask your sisters questions, so that this PCOS can actually be treated and managed. Yeah. So in diagnosing and treating PCOS, it requires a comprehensive outlook because you have to get, first of all, properly diagnosed. There are so many infections, there are so many morbidities that mimic PCOS. So you can't just say because I'm having one of these symptoms I've mentioned and you tag yourself a victim of PCOS or someone who suffers from PCOS. No, you have to first of all get to your doctor, get to your healthcare provider, and be properly diagnosed. There are some tests that will be run, there are some investigations that needs to be run, all right? And your doctor will prescribe those things for you. Your healthcare provider will prescribe those things for you. I mentioned earlier your hormonal profile test to check the overall hormones, all right, to check how your hormones are performing, to check which is lacking and which is more superior than the other, so that these things can be harmonized. Okay, so it's going to, you have to give yourself time for all these investigations before you be actually diagnosed of PCOS. Most often, it requires an ultrasound to visualize the ovary, how they are being situated, the cyst, and every other thing, because it is the ultrasound that will tell us this is the cyst, see where it is located, see the amount of the cyst, see the size of the cyst. Are they obstructing the eggs from getting to the fallopian tube? Where are they positioned? So the ultrasound is going to give you an overview, it's going to give you a pictorial image of what your ovary looks like. Like I said earlier, it is going to be a comprehensive outlook. So you have to give yourself that patience to go through all these phases of investigations, from your history taking down to your radiological imaging, so that proper diagnosis can be made. Okay? There are other factors that can be used to manage PCOS. So you also have a role to play here. All right? Factors like exercise. Exercise has a way of helping the body to regulate its functions, its central nervous system functions. Remember, it is the central nervous system that overly controls all these hormones. If you've not been exercising, uh, if you're not been engaging in daily activities, you may need to get into exercise. Yes, you may need to get yourself exercising more than usual, so that you can be able to balance these hormones. And your nutritional intake, okay, your nutrients, what kind of food do you eat, your lifestyle modification, do you smoke, do you drink excessively? All this impacts negatively on your reproductive health. So you need to maintain an optimal lifestyle, diet very well. If you have to meet your dietitian to make a meal schedule for you, please do that. If you have to meet your doctor to help you with supplements, if you have to meet your therapist to talk you out, like your mental health, to help you keep fit mentally, please do that. Do not hesitate, do not hold yourself back in seeking help. One thing with PCOS is you have to first of all accept that you need this help, because you cannot fight it alone. All right, you cannot fight it alone. And be open to the investigation, be open to the series of test examinations that will be conducted, so that you can combat this. Remember, you are not alone in this, and that is why whenever you are diagnosed with PCOS, you can talk, you can open up to your sister, you can open up to a confidant. All right, so don't just live in isolation, don't live in self-pity. These things can be treated, and you can also regain back your fertility. Okay, so don't just hold back, don't just carry it alone. It can be heavy on the shoulders, it can be heavy on the shoulders, so don't just carry them alone all by yourself. Seek help and follow your help. Be compliant with your medications, be compliant with your dieting, your exercise, and your lifestyle modification, so that we all can combat PCOS. All right. So thank you for watching this video. I hope you get encouraged. I hope you got value watching this video. And don't forget to share to your friends, especially your sisters and your mothers. Don't forget to share to them, because you may not know who you're helping with this video. Okay. And until next time, see you. Bye.